From the most trusted names in local news, KDPG Sunday Edition.
Good morning and welcome to the KDPG Sunday Edition. I'm Stacy Smith. It often attacked without warning in the spring and summer, leaving its victims paralyzed. Many of them were children. Polio contracted this devastating disease, including a man who would become the President of the United States, Franklin D. Roosevelt. Thanks to the innovative medical and scientific research at the University of Pittsburgh by Dr. Jonas Salk and Dr. Julius Jungner, and separate research by Dr. Albert Sabin, effective vaccines were created to prevent polio, which has almost been eradicated around the world. That was the 20th century. Now in the 21st century, fear has returned as a polio-like virus is paralyzing a number of victims, especially children. It is called Acute Flaccid Myelitis, or AFM. As John Shumway reports, the origin of this disease remains a mystery.
The pictures from around the country are heartbreaking as we see small children betrayed by their bodies. Dr. John Williams is the chief of the Division of Pediatric Infectious Diseases at Children's.
Yes, this is scary. Yes, it can be a very serious disease, but it's extremely rare.
1 in a million, he says. Acute flaccid myelitis is a disease similar to polio, resulting from a number of viruses that millions of children get each year.
We don't know why only a very, very few develop the nerve problems from the virus.
In fact, multiple siblings could have the virus and one or none get AFM. So what do you look for?
It comes on over a couple of days, and it usually shows up as weakness of one or both arms or legs.
Dr. Williams says AFM usually impacts one side more than another.
If a child has fever or runny nose or diarrhea, none of that should raise concern for AFM. It should only be if the child has weakness of arms and legs.
Doctors will treat the symptoms, but there really is no cure or vaccine. And recovery?
Most kids do experience some recovery, and some kids will have a full recovery, but a lot of kids are left with residual weakness, which can be from mild, such as weakness in one arm or leg, or in some cases it can be severe, where they're not able to walk.
Like any virus-borne illness, it is spread person to person, so
if somebody is sick, they should cough into their, or sneeze into their elbow. And hand hygiene. Most germs are spread by hand contact.
Dr. Williams says there is no answer as to why some kids get AFM, but he points out that when it comes to childhood risk, the flu and riding in a car are much more hazardous than acute flaccid myelitis.
Parents and families should remember that it's very rare.
John Shumway, KDKA-TV News.
This morning on the KDPG Sunday Edition, we will take a closer look at what we know about acute flaccid myelitis, or AFM, and what we don't know. Later in the broadcast, we will be joined by Dr. Karen Hacker, the director of the Allegheny County Health Department. Right now, we welcome Dr. Amish Adalja, a senior scholar at Johns Hopkins University's Bloomberg School of Public Health and is based here in Pittsburgh. And Dr. John Williams is an international authority on the epidemiology of respiratory viral infections. He is chief of the Division of Pediatric Infectious Diseases at UPMC Children's Hospital of Pittsburgh. The focus of Dr. Williams' research is the basic and clinical investigation of respiratory viruses. David Scribman is away this week, so we welcome back Sally Stapleton, the managing director of the Post-Gazette. Gentlemen, thank you so much for being with us this morning on the KDPG Sunday Edition. Amish, thank you for joining us again. You've been on before. Dr. Williams, this is your first time here. I want to pick up on something that you said and what we have also said, and that is there's a lot we know and there's a lot what we don't know about this. And you said that you know, basically this is rare, so parents shouldn't be that concerned about it. But they are concerned because this is a disease, as we've said, it's like polio, and polio was absolutely frightening. It has thousands of children through the point of finally mid-50s when the vaccine was finally developed were being affected by this. Even though the numbers are small, that idea that your child could be affected by a paralyzing disease, and by paralyzing we mean an arm, a limb, or even breathing capabilities, how do you know, it's still that frightening out there.
I think it is very scary. As both a parent and a pediatrician, part of what makes it scary, even if you know in your brain that it's rare, there's something frightening in your heart about thinking about your child being unable to move. And we're all more scared of things that we don't understand. So yes, driving in the car is quite dangerous statistically, but we drive every day, so it's very familiar to us. And as was mentioned, lots of kids get the flu every year, and several hundred kids in America die of flu every year, but we've all heard of the flu. It doesn't seem mysterious. It doesn't seem unusual.
And there's a vaccine for the flu.
And there's a vaccine for the flu, which can prevent a lot of those severe diseases and deaths, especially in children. So I think AFM is particularly frightening because the doctors and scientists have said we don't fully understand it. And it seems to parents that it can strike anywhere randomly without warning, which is true. And there's no way to predict which child is going to get it. We do know that the viruses that are associated with AFM are common viruses that millions of kids get every year over and over. And so it's almost like playing a giant biological lottery to know at random when will that one child, get AFM.
Doctor, do we know which virus this is?
We don't. That's kind of part of the mystery and why this is so scary for many people, that there isn't one virus that's causing this. There probably are a group of different viruses, things that are related to polio but not quite polio, things like enteroviruses, other common cold viruses like the rhinovirus, even West Nile can cause it. And the fact that there's not one single thing that you can say you've got this virus makes it very hard for the general public to understand it, and it adds kind of to the anxiety that this is some mystery that the CDC can't even figure out.
So you do know that West Nile can cause this?
Right, West Nile is a common cause of this type of paralytic polio type of syndrome, but it's probably not the case in some of the cases you're taking care of it, but it is something that you have to, it's on the long list of things that can cause AFM.
I guess probably you've already probably thought of this because your researchers can do this. Is there any possibility that this is a mutation of the polio virus?
No, so that we know for sure because the CDC in these outbreaks of AFM in the last few years have done a lot of testing, and none of these cases are due to polio. But what Amesh said is absolutely correct. These are polio-like. They're cousins of polio, the enteroviruses. And it's been known for decades that other enteroviruses related to polio could cause a similar syndrome. In fact, I saw one myself as a young doctor more than 20 years ago. What's new is that in recent years, we're seeing more cases, several hundred a year, in 2014, 2016, and perhaps this year, that are due to these enteroviruses when we find a virus. In many cases, a specific cause is not found, as Amesh said.
Well, I'm sorry, I was just wondering, the polio virus, it was stumbled on really, the determination that it was basically spread by feces. I mean, it was related to feces. You have no clue about how this one is either, because you said West Nile, we know that's mosquitoes, but you're also saying it's not necessarily always connected to West Nile.
Right, so sometimes when they do find a virus, so the enteroviruses that we mentioned before, spread either through the respiratory route or through the GI feces route as well. So there's lots of different routes because it's probably not just going to be one virus like we've said, that there probably are several that have this capacity, and we don't quite understand why these viruses are causing it now and where this happened, what happened in the past. This really has only been on the radar since 2014, but we don't know what was really happening before. But it's probably respiratory and gastrointestinal, and then in rare cases West Nile can cause this as well through mosquitoes.
Scientists and physicians have talked about this 2-year theory. You mentioned the first ones being in 2014, then there was another spike in 2016. It does seem that the numbers this year, if they're tracking similarly, will not be as high as 2016 and 2014. But can you talk about why the interval might be occurring? What's the theory behind that?
Well, I think Amesh and I spoke about this, and I think most scientists believe, and there's some evidence for this, that as a virus sweeps through a community and infects lots of people, which these enteroviruses do every year, and people are familiar with things like hand, foot, and mouth. That's caused by enteroviruses, and people often hear there's a lot of those cases. So if a lot of humans get infected, then a lot of those people kind of have immunity, and it lasts for a while to protect them. Mm-hmm. That immunity goes away, and more children are born, and so in a couple of years, more around who are susceptible to that virus. And this has been shown in a study in Japan where you could see different enteroviruses, some associated with AFM and others not, that showed peaks of activity every couple of years. And we've seen this in the past for respiratory viruses such as human metapneumovirus and respiratory syncytial virus. So we think it's due to waxing and waning immunity in the population.
I see.
You've indicated that we started to really see the first spike in around 2014, but there were cases like this prior to 2014, correct?
There have been some, but a small number. It was not an officially reportable condition until 2014, which means that if a doctor sees a case, they should report it to the CDC. Without that in place, it's possible that people were seeing cases and not reporting, but I think the world of infectious diseases is small enough and the world of pediatrics is small enough. If we were seeing numbers anything like we have seen since 2014, the field would know. So I agree. I think the evidence shows that this is new since 2014.
We have said this is a polio-like virus, isn't it? And it causes paralysis usually to an arm or a leg or both, or sometimes a respiratory system itself. When someone was affected with polio, many times they might have had a fever, they might have this or that, and then nothing after that. They weren't necessarily affected by it. For others, they have had it for the rest of their lives. They've had a paralysis of an arm, a leg. Do you have any idea the long-term prognosis for something like this with this particular one?
I think at this point we don't really, but we do know something from the 2014 and 2016 cases. We know that some children will make a full recovery. Other children will have prolonged weakness in that limb or limbs that are affected. It can be weeks and months of recovery, and so these patients really benefit from a place like Pittsburgh where we have terrific doctors, nurses, rehabilitation specialists, therapists. It's a long road. We can't predict for an individual child how they're going to do as they recover.
Does it kill the motor neuron as polio basically did?
It works very similar. Well, again, as Amesh said, in many cases of AFM, we don't know the cause and don't find a specific cause.
Right.
The most common cause that we do find are enteroviruses. And the data we have so far suggests that yes, it kills the motor neuron, the nerve cell, in a way similar to polio. And some enteroviruses seem to do that more than others.
Which is why then you have a longer lasting effect from the particular disease, because
Correct.
that motor neuron's been killed.
So, you know, parents are all watching this show this morning, and if I am someone who works with children in schools, in sports, Little League sports, is there any advice you have for them on keeping watch on the children that they are guarding?
So these are ubiquitous viruses that are common cold viruses that are very, very hard to avoid. And the best thing you can tell parents is just practice good hygiene. Some stuff that Dr. Williams said yesterday in his press conference of coughing into your elbow, good hand hygiene, and also thinking about risks that are real, like flu. I think it's going to be hard to get people to collaborate their risk perception, because this is something that's getting headlines and scaring people. But in general, all coughs and colds that these children are going to get in this season are not going to lead to this. It's going to be very, very rare. It's like one in a million, but it's going to be hard to kind of ratchet down the panic that people have. And I think it's important just to do the basic things that you would do for any respiratory virus.
Well, gentlemen, thank you for being with us. Dr. Williams, you're going to be departing. Amos, you're going to stay with us, and the KDPG Sunday edition continues. We'll also be joined by Dr. Karen Hacker, Director of the Allegheny County Department of Health.